Hey, good evening, Pahrump. I'm Dr. Reiner, your host of the Independent Doctors of Pahrump. And tonight is Monday, obviously, and this is not a rerun, so that's good. Trying to keep a string of live shows going. And so I know we usually get callers, so I don't even try and lead in there. I'm usually wait for Ray to pick up the phone and call with an interesting question. And I know Chuck is watching, and I did get your packet with the Lyme information in there. I tried to preview it a little bit today, but I haven't had a chance to go through it. But it certainly is very interesting. I'm going to watch that video and that DVD when I get a chance to do that, hopefully very soon. I thank you for dropping that off so that we can possibly discuss that. I have been getting a lot of questions lately because of all the advertising about hepatitis C, and I guess we'll get to that a little bit after we deal with Ray. Ray, good evening.
Yeah, Ray the Flagman. Glad to see another live show. You're running a string of live shows, and it's incredible.
Yeah, well, thank you.
And something that's really been bothering me. I heard Dwight Lilly's show on the radio the other day. He was talking about chemotherapy. He threw out a couple numbers that were astounding, that only 2.5% of the people that are treated with chemo actually have a positive result as far as cancer and remission. 2.5%. He also said majority of doctors, when asked if they would subject themselves to chemo and radiation, would not for themselves or their families. If this is the case, why are we still doing this? Isn't there something, it amazes me, Doc, that for so many years we've been researching and trying to find a cure for cancer. We could put a man on the moon, send probes out into outer space and get pictures of new galaxies and everything else. We could go on an asteroid and take a sample and bring it back to Earth, and we don't have any hope on this cancer. We're still killing people with chemo and radiation. I want to understand what's going on. If these figures are correct, if there's only 2.5% of people that go into remission after chemo, if doctors themselves won't subject themselves or their families to it, then what is the answer? Maybe you can talk about it a little bit and I'll open the lineup, but this is really something that we have to discuss. Is it just money? Is this what it is? They want the beat to go on so the money could keep flowing in as long as they don't find a cure? So I'll get off the air and I'll listen, but I just hope that you touch on this subject thoroughly tonight. Thank you, sir.
You're welcome. I think the idea is that I think you're right. I think that chemotherapy is a very barbaric way of treating cancer, because if you look at what chemotherapy is that, I mean, let's look at it from a non-cancer perspective. Let's look at it from bacteria. If I have a bacterial infection and I give you an antibiotic, I'm only going to kill so many of those bacteria with that antibiotic. And literally, the more I give, the more resistance I'm going to develop. So therefore, there's this natural selection that works in the smallest of organisms and the largest of organisms, being us. And natural selection means that when the environment changes, there are people that are naturally resistant. I know you've seen it in all the TV shows when, like Contagion and all these epidemics. There's always a few people that are not going to succumb to the virus, that are not going to die from this particular illness. And the same is true on a cancer, meaning with every cancer, meaning there are different strains. As a cancer grows, it mutates. So some of the cells are going to die from this chemotherapeutic agent. Some of them are going to divide at different rates. And most of these chemotherapeutic agents are basically designed to interfere with the division rates. So when you've got these division rates going on in different times, the chemotherapy agent has to get into the DNA, destroy the DNA, and prevent the cancer cell from dividing. Not all cancer cells divide at the same time. So naturally, you're going to select for resistant cancer cells. So, you can cut the tumor out, you can bulk it out, you can give preoperative chemo to try and shrink the tumor so it makes it clearer for the surgeon to remove. You can radiate it after you've done the surgery because you don't want to radiate prior to it because that burns the fields. And then if you've ever tried to do surgery on a radiation burn, it's like cutting through scar tissue, it just doesn't want to heal. So in that respect, you're going to be dealing with you know, a non-surgical thing. So there is a definite order to the rate at which they do that, and science has shown that some cancers respond differently to other chemotherapeutic agents. But to go in and make a cellular reversal, that's the part that's very, very difficult. And your immune system, number one, had a defect to allow the cancer to grow. It didn't kill it before it had a chance to grow. So therein lies where the defect is in cancer. And so the newer therapies, as you notice on TV, the what they call the rafumab and all these other drugs, these are basically monoclonal antibodies that are used to get at the source of the disease. And so they're basically now targeting your immune system, so to say, to create antibodies to the actual cell, so that it just destroys the cell, whether or not it is dividing or not. And it looks for the proteins on the cell, it attacks those and destroys the cell so that it can't divide. A dead cell is basically, it can't divide. So that's how they're moving in terms of maybe more effective cures if we can target a specific protein on that cell to get your immune system to go in there and kill that. So the reason cancer chemotherapy, I believe, is so devastating is because it affects all rapidly dividing cells. So what are the most rapidly dividing cells in our body? GI tract and our bloodstream, our marrow, or white blood cells. So we're actually killing the cells that are trying to kill the cancer. That's why it doesn't work. And that's why people probably, you know, with certain stages of cancer might actually live a more productive life if they didn't get anything, depending on how fast the cancer grows. And the key is in prevention, but that wasn't your question. Your question was more, why do we do chemotherapy? I guess it's because the best that we have right now, and why doctors see it is because they understand it on a scientific level. But when you're sitting in a room and a doctor tells you have cancer, your first question is going to be, well, what do I have to do? And most people, we've moved, I think, as a society a little past that. We now have some, you know, we're living long enough to where, okay, you know, you're 80 years old, you develop cancer, maybe you think, you know, I'm probably not going to, you know, I can live another year or two, that's great, or I can get chemo and I can die within a very short period of time. And the cancer's been there a while by the time it becomes palpable, it becomes an issue. So I advise patients to, you know, look at how far the cancer spread. Sometimes they're slow at growing, and just live with it. I mean, you've been living with it for 5 years before it became a problem. Now you're living with it when it's noticeable, and you don't have to suffer all the consequences of losing your hair, nausea, vomiting, all the other stuff that comes along with chemotherapy. And maybe science will continue to develop like they've done with melanomas. Melanoma being a easier cell to target for division therapy. So anyway, I would say that would probably hopefully answers that question. And if I didn't, then call back. And we have Marvin on the phone. Marvin.
How are you, Dr. Reiner?
Good, Marvin. What can I do for you tonight?
I just want to compliment one of your workers.
Okay.
Melanie.
Okay.
I don't want to, I sort of don't like doing this, because then when I say how good she is and helpful, everybody in Pahrump hears that, or whoever's listening, especially your regular, and then I'll have a hard time getting an appointment with her. You know how that goes?
Yeah, but that's okay. But I'm glad she helped you. You know, she's our newest nurse practitioner, so I'm glad you found her very helpful. That's often very, very heartwarming and rewarding. So
yeah, I was in there last week, and like I said, I asked her for something. She questioned me about it, and being, you know, what do you call it? Well, antibiotic. How do you say that? Antibiotic?
what now?
An antibiotic. amoxicillin.
Okay.
I asked her for it,
Uh-huh.
and she questioned me about it, and I went over and picked it up. So I just want to compliment sort of you for having her there.
Well, I appreciate that. We got lucky there in the sense that the hospital chose to get out of the, well, the hospital got in the business of primary care in order to build up their revenue in order to sell the hospital. So that's what they did. So they made an investment, and so these providers were actually providing a service to the community and really had built some, relationships with patients. And Melanie actually was a nurse at the hospital before. I interviewed her over the holidays and brought her on the TV show. And she was really shy about being on TV, but she's, like I said, she's very conscientious. She wants to help people. She has a lot of availability, and I'm always there to help her if she can't figure it out. And I always try and pick up some new findings, physical exam stuff, and point it out to her. So she's been. She's really excited to be there and wants to be a part of this community. So I appreciate that she was able to help you, Marvin. I think that's really, really nice.
Well, don't get rid of her, please.
No, I had no intention. Believe me, I had no
and
intention.
anybody out there that's going to criticize the way I speak on not coming up with the right word of antibiotic, I'm not sure how to say it. Wait, and my bad memory.
Nobody's going to criticize.
Until you're 79 years old.
Right.
And then we'll see how you talk.
Right.
And think. If
No.
you can think. If you're still alive.
Right, and you're brave for calling into the show. But I got to go to break, and I'll be right back, and you can hang on the phone if you want to. Thank you for calling. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.